Hello. So I would like to present a study that we did on the gender dysphoria clinic of National Institute of Mental Health. It is on self-medication with gender-affirming hormonal treatment, and we wanted to look into the knowledge about the side effects, adverse effects of the gender-affirming hormonal treatment among patients as well. So just to recap, what is gender dysphoria? Broadly speaking, gender dysphoria is the distress that is caused when the person's biological sex or the sex assigned at birth and their gender identity do not quite match. So there are many terms used in it in slightly different contexts. So the term I use, gender dysphoria, is the DSM-5 term. So what are gender-affirming medication? They are hormonal treatment that suppress hormones of the biological gender while amplifying the hormones of the preferred gender so that the hormone levels resemble that of the preferred gender. So they are frequently used in the gender transitioning process, and they were found to have significant reduction. They were found to cause significant reduction in distress in transgender individuals. So these are the most frequently used gender-affirming hormonal treatments that we generally use and are recommended. So self-medication refers to taking of drugs, herbs or home remedies on one's own initiative or on the advice of another person without consulting a doctor. This is a recognized problem among individuals with gender dysphoria worldwide, and many reasons have been postulated in the literature: lack of access to specialized care, a long waiting time till the first clinic visit, and fear of discrimination, as well as we are talking about the transgender community. So why is self-medication so concerning? The first is that, as you can see, there are many potential adverse effects in gender-affirming hormonal treatment. As useful as they are, the possibility of adverse effects is there as well. So when you are prescribing gender-affirming hormonal treatment, you need to do a psychiatric assessment, an endocrinological and metabolic assessment, and a thorough risk assessment as well. The other thing is, if the patient or the person is not aware of the side effects, they might be more free in manipulating the doses, and the route of obtaining self-medication is also concerning. Authors have noticed concerns about buying medication through the internet, like problems in the shipping process and counterfeit products. So there was a dearth of research regarding gender dysphoria in Sri Lanka in general, and we could not find any studies exploring this niche of self-medication. So our study's objective was to explore the practice of self-medication with gender-affirming hormonal treatment in clients participating in the gender dysphoria clinic at NIMH. And specific objective-wise, we want to describe the socio-demographic features of the population, to find out the routes of obtaining medication, to describe reasons for self-medication. And on the other hand, we also wanted to know the knowledge about side effects and the prevalence of common side effects in this population. So this was done as a descriptive cross-section study, where the study population were clients who are older than 18 years old, or 18 years, attending the Navodaya Gender Dysphoria Clinic with a diagnosis of gender dysphoria. And regarding the exclusion criteria, we excluded those with comorbid severe mental illness unless they were in remission. And we gathered the data using a self-administered questionnaire. So for the results, now our sample was 85. There was a sample size of 85. And regarding the demographic characteristics, we found that the vast majority of our clients was female to male transgender, 89.4%. Male to female was 9.4%. And regarding the educational level, actually more than 90% were educated up to O levels. Regarding the age distribution of participants, you may notice that there are many participants, most participants who are younger than 30 years old. Actually, 80% were less than 30 years old. So about the self-medication practices, 21 out of 85 participants, that is 24.7, had taken gender-affirming hormonal treatment without a valid prescription. So, without a valid prescription, the options we found out were some were using medication on their own accord even before their first visit to the doctor, and some were buying medication from a pharmacy using an old prescription that had expired and taking a higher dose rather than the dose prescribed was also noted, and some used obtained medication from a pharmacy or any other source without a prescription. So the modes of obtaining medication, even though the majority of a significant proportion of participants did not disclose their avenues of obtaining the medication, among the rest, most of the medication were taken from a pharmacy. So the reasons for self-medicating, almost 1/3 of the impression that the waiting time before the first clinic is too long, which I admit is a significant problem because now there is at least a few months of waiting time, which we are trying to reduce actually. And the difficulty to physically reach a gender dysphoria clinic or a doctor was also an issue in 16.5%. 14.1% said that the clinic procedure is difficult, and 10.6% said they could not afford to see a doctor or come to the clinic. Regarding this difficulty in reaching a gender dysphoria clinic, bear in mind that this study was done from April to July this year. So I think we all have difficulty reaching point A from point A to point B these days. So knowledge regarding the drug side effects, these were the drug side effects we were concerned with. These are the most common drug side effects that are given in the World Association of Transgender Health Guidelines. So what we found was that only 42 out of 85 participants were aware of at least one common side effect of gender-affirming hormonal treatment. And regarding experiencing side effects, 12 participants, that is 14.1% participants, experienced at least one common side effect. So in conclusion, the majority presenting to the clinic were male to female transgender, and female to male transgender, and self-medication was noted in nearly a quarter of the patients. More than half had inadequate knowledge about adverse effects of treatment, and regarding the reasons for self-medication, long waiting lists and difficulty in reaching the clinic were recognized by many. So just to look back on what these results mean, the majority being, I'm sorry about the typo, male to female transgender is actually consistent with the world statistics. Generally, it's 1 in 15,000 male to female and 1 in 38,000 female to male. So self-medication in nearly 25% also was consistent with other studies. Some studies found about 20%, 23%. It was quite close. But I think one of the most important points here is that we were sort of preaching to the choir with this research, because we were talking about self-medication in patients who were actually in our clinic. So there could be a much wider proportion of clients who are not coming to the clinic at all and self-medicating quite freely. So the actual proportion of individuals with gender dysphoria who self-medicate is likely much greater. And also the poor knowledge about common side effects was concerning, since more than half did not know the common side effects. And when we examine the clinic process, giving knowledge to patients about side effects was done in the first visit. However, it seems that this knowledge is not quite retained. So there is a need for continuous patient education, and there are measures. There's a need for measures to reduce waiting lists. Perhaps we could have a more decentralized service. Now, of course, there are several clinics aside for the ones in Peradeniya and NIMH. So more clinics, more doctors, a general increase in accessibility would reduce this problem, we feel. So these are my references. Thank you for listening.